So thank you for participating in this standardized patient event where you're presenting a patient with a hip problem that is not appropriate for physical therapy, but it's a student's job to figure that out. And so we wanted to go through a couple of items within the examination to show you what your responses should be like and what you should expect the students to do with you. So the first thing that they may have you do is walking around the room. They may bring you out of the room, but either way you're going to want to have a little bit of a limp on that left leg, meaning you're going to sort of just have a little bit of a limp where it's difficult for you to put full weight on that leg. They may ask you to do some other things, like have you do a squat. So if you do a squat, you can go down and just put more of your weight on that right leg. And if they ask you why you're doing that, you can say because it hurts to put full weight on that left leg while you do a squat. With range of motion, you're going to have a couple of motions that are limited in that left hip. So one of the motions, and they might test this in different positions, so we want to demonstrate that. One of those motions is what's called internal rotation. So on this left hip over here, internal rotation is where the thigh rotates inwardly, and when your knee is bent, that means your knee is bending out to the side. So I'm going to zoom this in. Okay, and Corey, go back to the middle. So internal rotation is moving the foot out, which rotates the thigh inward. That motion is limited quite a bit. You can only go maybe 10 or 15 degrees, which is just a little bit, as opposed to a normal range of motion, which would be like 30 degrees. So they may, see that's normal, and then this is 15 degrees here, so just a little bit. And then with the good leg, with the right leg, you can let them bring it out or have you move it out as far as you possibly can go with that one. So the internal rotation is limited. They may test that in sitting, but they may also test it in a laying down position. So I'll have Corey lay down. And in a laying down position, what they would do is the same thing. They will rotate that foot outward to rotate the thigh inward. And so here's a full normal range of motion, about 30, 45 degrees. And so in this case, you're going to want to limit it. Now, of course, this will be on the left hip. So as you bring this leg up, you're not going to want to rotate out. And you're going to want to not let it go any farther. They are going to do a neurologic exam, so they're going to test reflexes, they're going to test sensation, and they're going to test muscle strength. We'll have your reflexes be whatever they are. Just do the sensory exam, however they want to do it. Your results for sensation testing are going to be normal. With strength testing, however, with that left hip, it's going to be just a little bit weaker. So I'll have Corey sit up again. So normally what would happen with this left leg is I would say, Corey, lift your knee up, don't let me push it down. And I would push, and he can hold it. That's normal strength. In this case, what we want you to do, so go ahead and hold it up. And as I push, he's going to give a little bit. It's not just a collapse, you're not super weak, but he's going to give a little bit, and this side is going to be weaker than the right side. So with the strength testing piece of the hip muscles, so that's going to be lifting the knee up. They may have you lay down on your right side. So they're going to check your hip strength this way. So let's say raise your leg to the ceiling. And again, normal strength would be when they push, you can hold it. So go ahead and lift up and give me normal. Where they're going to push and you can hold it. But in this case, you're going to be weak. And as I push, you'll sort of let it down a little bit. The same would be true as with when you're on your stomach. What they're going to have you do, so your right leg, go ahead and lift that up toward the ceiling. Notice that not only does he have the strength to lift it up, but he also can get that leg pretty high off the table. And he would be able to hold it as I push. However, with this left leg, you're really not able to even lift it very far off the table, partly because you don't have the range of motion to do that, and partly because you don't have the strength. With regard to, in this case, you also have a history of back problems, of back pain. And so we put that in the case to make it a little bit more complex, because part of their decision making is to figure out, is this hip pain coming from their previous history of back pain, or is the hip pain a new problem? So again, in this case, the hip pain is a new problem, but we're trying to make it a little more difficult with regard to your history of back pain. So there's a couple of things that make that back pain less. If in a standing position, if they have you bend backwards, so that's extension. If they have you really go back far, and especially if they have you do it multiple times, so they'll say, well, do that 10 times for me, that's going to reproduce your low back pain symptoms that are described in the document that you have. The other way that they'll look at extension is if you're on your stomach, they'll have you prop up on your elbows. So again, this is the same motion as what we just did in standing. It's lower spine extension. So again, if they have you prop up on your elbows for a period of time, or if they have you repeatedly go up and down, then that is also going to reproduce those back pain symptoms that are described in the document that you have. Another thing they're going to do is they look at your spine. Is they're going to provide compression or loading. So Corey, I'll have you stand up and maybe face that way. So they're going to do a variety of things to see how you do with putting weight on that leg. And we already know that it hurts because watching how you did the squat, watching how you had your limp with walking. But they're going to have you shift your weight over to the side. And then they're going to provide compression through various parts of your leg and through your pelvis, and they're going to shift you over and push down. When they push down on that left side, that's going to reproduce that hip pain, again, that's described in the document that you have. If they push on your shoulders up here and push down, that is also going to reproduce that hip pain. And then as you sit on the table, the other thing that they might do is they may get up on the table and they may push down on your back through here. And again, we're going to have that reproduce the hip and low back pain symptoms. They'll do a variety of other tests with the lumbar spine. They'll be pushing on it in different ways. They'll be moving you in different ways, and just let the response be whatever it is. They may, while you're on your stomach, they may have, they'll do a palpation exam where they're looking for tender muscles throughout your back and through your buttock. And you're not going to have any pain with that palpation, but what you'll report to the student is when they palpate in this left lower back area, and when they palpate in this left buttock area, you're going to report that there's muscle tension present. And of course, you can't really simulate that well, so that's just what you'll report to them as they're feeling that area. All right, so there's a couple of tests that they're going to do for that left hip. So go ahead and roll to your back. One of the tests that they're going to do is a test where they're going to push down through your leg, so they're going to push in this direction, and they're going to sort of stir your thigh around as they push down and put pressure through that hip joint. And they're going to probably add some rotation, and they're going to kind of scour this hip around like this. That's going to create pain on the left side. Another test that they might do that's going to create pain in that left hip is they're going to put one foot over your knee, and they're going to let your knee drop down to the outside. And so as you lower that one to the floor, you're not going to be able to lower it as far, and you're going to complain about your hip symptoms with that maneuver. Another test that they might do is looking at the mobility of your hip joint. So this may take many forms in terms of whether they use belts or straps to help with this, how they position their body. But basically, they're going to be trying to move that ball out of the socket. They're sort of looking at whether there's some slack in there or whether it's really tight. So they're going to be up there. They may have their hands in pretty close, and they may pull down, they may pull out. Not quite sure to what extent they're going to spend a lot of time on that. But if they do, what you're going to want to report is that the left hip is tight. So when they do that on the left hip, it's going to be tight. Another test that they might do, let me make sure the camera will get it, we'll do Thomas' test. Another test they might do is they'll have you slide down and then lay back. Yep. And they'll have you pull your knees up towards your chest. And they're going to have you hold on to one knee while you drop the other leg down. And so in this instance, with that left hip, rather than letting it come all the way down like the right side, you're not going to let it come down as far, and you're going to report hip pain with that. Another maneuver that they'll do, you can slide back up. Another maneuver that they'll do laying down is looking at your hamstring length. So they'll have you bring a knee up with the bent leg, and then they're going to ask you to hold your leg here and straighten your knee. And so what you want to do is not go as far as you can on the right side. So if this is his actual amount of movement, you're going to want to restrict it to there. And then so then when they test the good side, that left side is going to have less motion with that test. One final test to talk about. They're going to do a test where they're going to have you roll onto your side. And they're going to bring this leg up, bend your knee, they're going to bring it back a little bit, and they're going to try to let this leg fall to the table. So again, compared to your right side, you're going to want to have this left hip not fall as far toward the table. And again, these are the tests that we've been talking about have been some tests of muscle tightness. Because you had this hip pain for so long, you have a lot of muscle guarding around there, and those muscles aren't letting the hip move the way that it normally wants to. So we'll have time for questions before the actual simulation coming up, and we'll go from there. So again, thank you very much.